Hello and welcome to Medical Dialogues. I'm Dr. Ganma Soni. Here's what I bring to you all from the world of medicine. 20-fold higher increase of sudden cardiac death between 30 and 40 years with type 1 diabetes. ESC Congress 2024. Data from Danish study presented at European Society of Cardiology Congress 2024 reveals that patients with either type of diabetes, particularly type 1, experience higher rates of sudden cardiac death across all age groups. This increased risk highlights the need for better risk assessment for these individuals. Their latest study investigates the impact of sudden cardiac death on people with diabetes within the general population. It also explores how much life expectancy is reduced due to the sudden cardiac death in individuals with both type 1 and type 2 diabetes. The researchers used 2010 data from the entire Danish population, which includes about 5.5 million people. They found 6,851 cases of sudden cardiac death and matched these cases with individuals who had type 1 and type 2 diabetes based on prescription records. They then determined the loss of life years for each group of diabetes diagnosis. For individuals with type 1 diabetes, the average age was 50 years, with 57% being men and 5.5% having arrhythmia. For those with type 2 diabetes, the average age was 65 years, 52% were men and 11% had arrhythmia. Sudden cardiac death rates were consistently higher across all age groups for people with diabetes compared to the general population. The incidence of sudden cardiac death per 1 lakh person years indicated that type 1 diabetes is associated with a higher risk of sudden cardiac death across all ages up to 90 years compared to the general population. Specifically, individuals with type 1 diabetes had nearly a 10-fold higher risk of sudden cardiac death at age 30 or younger, a 20-fold higher risk between ages 30 and 40 years, and this risk decreases with age up to 90 years. For type 2 diabetes, the related risk of sudden cardiac death was nearly 6 times higher for those up to 30 years old, about 5.6 times higher for ages 30 to 40 years, and the risk decreases with age up to 90 years. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.